Hello, everyone. It is my pleasure to open the next session, which is also very interesting. And the main discussions here will be directed to more life-oriented genetic testing. We have a very stimulating panel of 3 speakers, so the speakers will be more comfortable with the time. There will be no pressure. And I think that there is a consensus there is no gender balance this time. So there is a consensus among the gentlemen that we should give priority to ladies. And I am happy to give the floor to Mrs. Boryana Gerassimova. Mrs. Boryana Gerassimova is an old friend of NM Genomics and in a way part of our ecosystem. Mrs. Gerassimova, please, I will be happy to hear your lecture.
Hello, Dr. Georgiev. Thank you very much for the invitation today. Just let me share my screen and I'm going to start. I think you should see now my screen.
Now, yes. Now, perfect.
Yes, wonderful. Wonderful. So basically the topic that I want to talk to you about today is the practical application of lifestyle genetic testing and our multidisciplinary approach towards it. First, I'd like to introduce myself. I'm a healthcare entrepreneur and patient advocate, and I'm founder of the biotechnology company Regena. My team and I have been working and innovating in the field of nutrigenetics, aiming personalized disease prevention in the past more than 7 years. And I'm very grateful that in the next few minutes, I'll have the opportunity to tell you about our approach, specifically to lifestyle genetic testing. While it's still controversial in a global scope, we have implemented a methodology in order to make it highly impactful for the clients' lives in the long term. It takes a whole village to raise a child. I'm certain that you have heard this African proverb that means that an entire community of people must interact with children for those children to grow in a safe and healthy environment. And after conducting an internal client survey of more than 150 clients and following client stories through time, I'm convinced that it takes a whole multidisciplinary team of experts and a sophisticated methodology in order to help an adult person reap the benefits from their lifestyle DNA test result, build new habits, and achieve lasting results. Lifestyle direct-to-consumer genetic testing is exciting, but I think the benefits are quite questionable. I understand that this statement contradicts with the effort of many direct-to-customer genetic testing companies, but let me elaborate. Direct-to-customer genetic testing provides only partial information about the person's health. Other genetic and environmental factors, lifestyle choices, and family medical history also affect the likelihood of developing many disorders. The direct-to-consumer method of marketing facilitates usually the sales of these tests without the involvement of a healthcare professional or ongoing patient support. In the recent years, few providers started offering optional consultation with genetic counselor, but in many cases they are not addressed when using at-home genetic tests. There is an additional issue. Lifestyle genetic testing usually covers multiple fields of expertise, such as nutrition, metabolism, sport, cardiometabolic health. And after more than 7 years in the field of lifestyle genetic testing, we are still struggling with practitioner adaptability of these instruments. And even if the patient brings a genetic report to a specialist, it is more often than not dismissed. And at the same time, I believe you can agree with me, we cannot expect the clients to have the necessary level of health literacy in order to grasp and properly implement the information correctly in their lifestyle. Clients rarely can see the big picture health-wise, and this is a very serious issue of direct-to-consumer testing and missed potential for significant client benefits. And this may lead to people making important decisions about disease treatment or prevention based on incomplete and misunderstood information from their test results. Contemporary DNA results are lengthy. For example, in Regena, we are working with whole personalized books of more than 70 pages and sometimes up to 200 pages. While the clients report they find the information interesting and are quite happy that they are tested, they find it challenging to understand and find difficulties in applying it in their lives. And what is more to it, they cannot evaluate their polygenic risk score. And this is the score that tells them how their risk compares to others with different genetic constitution. And most of the clients focus only on single markers. Collecting feedback at different stages of our services, we have found that the clients most often struggle with first understanding the results, of course. I've heard many times whether predisposition to celiac disease versus having celiac disease and needing to actually exclude the gluten from your diet. They struggle with correctly interpreting the results. Several times I have heard the following statement: my DNA test told me not to eat meat anymore, while actually the client was referring to saturated fat intake. They struggle with application of the information in their lives. For example, what should I eat now that I have all this information? Building lasting habits. They mentioned that they feel great, but as long as they follow the recommendation, which is quite logical, I believe you can agree with this. Seeing the big picture. I think this is maybe the most important part of it. They struggle with grasping the most important priorities in connection with their current health and receiving truly personalized advice. And what is actually the use of all this information if it only stays on paper and makes them feel guilty that they are not following the guidelines that they have received? I want to address the importance of the big picture and demonstrate the significant client benefits that we can achieve after a standard lifestyle report in this case. And I'll do this by sharing what I learned from one of my recent lifestyle reports. And it is a typical lifestyle report. You're going to see this. It is not specifically aiming to evaluate chronic disease risk. So I know this is a lot of information, but worry not, I'm not going to bother you with each one of these markers. You can see here only a small aggregated part of my results. And I have shown the following sections from my report. I have nutrient metabolism, I have food intolerances and sensitivities, I have cardiometabolic health, exercise physiology, fitness and injury risk, and eating habits. You can see that I have some risks that are in red and some talents, and it's also quite exciting to understand more about yourself in this case. It is a lot of granular data, and usually this is as far as a client would go. Unfortunately, they will miss key insight for their health by not seeing their polygenic risks and the bigger picture behind the results. In order to maximize the benefit of DNA testing and improve clients' health result, we have developed a detailed methodology that we follow with the clients. We take into consideration multiple factors, such as health status and current lifestyle and family history. They, combined with the DNA result, are evaluated by a multidisciplinary team. At the end of the process, the client has passed multiple consultations and receives highly personalized and actionable health priorities. In my case, following this methodology led to the identification of multiple serious health risks, one of them of osteoporosis, and the recommendation of highly personalized measures that would have otherwise been missed. You can see here in the DNA result analyzed selectively two groups, one used as markers contributing to an indirect risk of low bone density and osteoporosis, and another section showing the importance of increased sport activity for my cardiovascular health and appetite control. In order to receive the full benefits from my result, which cover more than several fields of expertise, I talked to 4 of our experts, a medical geneticist, a dietitian, sports psychologist and trainer, and a specialist in regenerative medicine. The findings in my DNA result on their own have different priority for different people. If another client received similar results, the priorities and recommendations would almost certainly have been different in this case. However, here's some of my insight info. As I told you, we follow quite a specific methodology. I am a cancer patient, and as such, the whole picture changes because I have numerous health risks. There are actually more than I'd like to be reminded of. And obviously, I try to take very good care of myself. I'm very cautious of supplements and train regularly, although I struggle with injury several times per year, and my DNA results confirm this. And up to the moment, I actually have not paid attention to potential health risk of osteoporosis. However, one of the multiple health risks that I have after my cancer treatment is this one, mainly because of the high doses of corticosteroids and radiotherapy. And I'm also at risk of early menopause, contributing to risk of low bone density, and I know that one of my grandmothers had osteoporosis. And certainly, the risks that I have kept focus on up to this moment have been connected more with avoidance of cancer relapse and not something as osteoporosis that may take another decade to develop. Receiving this DNA result and interpreting it with information about my health status and family history and running it through our software core made the whole difference. Because now I am not focusing on single markers. For example, I'm not just monitoring my calcium levels that are potentially low or keeping my standard activity levels that I had to the moment and avoiding risk because I indeed have developed lactose intolerance. Now I have a specific aim and a complete strategy. And all these benefits will be missed if we only hand the complete result to the patient or offer only a short consultation. And here in this slide, you can see the personalized plan that resulted from it. And I received personalized recommendation in 4 main directions: supplementation, nutrition, training, and screening. And notice how, even though I do not have a genetic predisposition to low levels of vitamin D, and I can metabolize caffeine perfectly, my recommendations are modified with, in this case, extremely high doses of vitamin D and very severe intake of caffeine. And also, although I am physically quite active, I should significantly increase my movement as part of the prevention. And it was found that it genetically is a major factor for my weight management, cardiovascular health, and appetite. And again, our aim is to not to overwhelm the client with information. It is to help them transform the way they care about themselves in order to achieve better health. And we measure success mostly in clients that have implemented meaningful changes and achieved results. And therefore, we don't ask the client, what is the information you want to receive? We ask them, what aim you want to achieve? We are discussing health aims, and we are painting the big picture of their health together. And this is the reason why we have implemented a methodology that, according to our surveys, greatly increases client satisfaction and health benefits. We have decided actually to never offer direct-to-consumer testing, but rather direct-to-consumer service. And now our multidisciplinary team consists of exceptional experts in the field of medical genetics, dietetics, psychology, sports and sports medicine, endocrinology, and others. And I think the key component in our process is our interpretation software core that helps us generate custom, dynamic, and focused reports with a sufficient level of detail using the Bulgarian language. And this makes the results much more understandable for both specialists and clients. First, of course, we get to know the client's health history, and then we define the whole service for the client in advance, for example, which markers or panels to test, how to interpret them, and which experts from the team to engage, and of course, what follow-up is necessary afterwards. And we aim to offer finished solution and programs, not only DNA tests. Thus, we are using the DNA tests as the instrument that they are meant to be from the beginning, because with the proper methodology, we can be extremely powerful tools for lifestyle change and not only informing the client of random DNA traits and thus receiving the huge benefit for the client health at the end. And I want to finish with an example of one of our very successful programs. It's called Restart, Love Your Body. And it is quite interesting because we impact with client on a psychological level, because this is an 8 weeks dynamic program, which is based on the genome and helps women and men transform their perception of the needs of their body and form meaningful and highly effective habits. And of course, it includes lifestyle DNA testing, but in combination with the expertise of medical geneticist, dietitian, psychologist, sports psychologist, and trainer. You can see how much of the psychology part we are introducing in this lifestyle genetic testing program. And actually, the methodology you follow includes a very high degree of personalization, adapting the recommendation and guidance to the client's health, genome, personality, and current lifestyle. And it has the potential to indeed make lasting transformation of the client's mental and physical health. And I think the program restarted successfully partially because it harnesses the motivational surge resulting from DNA testing. Many patients share with us that the results they receive make them want to take better care of themselves. And indeed, research confirms that nutrigenomic testing can have amazingly empowering effect on clients and make them more willing to follow recommendations. And this, of course, leads to accomplishing better and more lasting results for their health. And for me, actually, this is the empowerment. This is where our efforts need to be focused, in the meaningful interpretation of the data with empathy and support for the client. And I want to thank you very much for your attention, and I do hope that you found some interesting insight for you from this presentation.
Boryana, this was a really inspiring and touching presentation. Thank you very much.
Thank you, Doctor.
I adore the way you presented lifestyle testing from your perspective. It's a really unique experience.
Indeed, it is.
Yes. Thank you very much. Robert,
Thank you.
now it's your turn. Please go ahead.
Hello.
Hello.
Are you listening well? Yeah. Thank you again for inviting me this year as well as the last year. Yeah, and I'm very happy to be here with you. I'm almost 6 hours now online listening from the morning. Yeah, and
Well, I'm also 6 hours, but I'm moderating 5 hours of them. So
yeah, great.
my exercise is even more exaggerating. But
yes, and I'm enjoying in most of the presentation. Our topic for today is lifestyle and health advances. And last year I was discussing about a modification of one of our tests, the nutrition test that we've tried to modify at that time with the several other biomarkers, trying to improve the significance with the cholesterol level, especially with the LDL and HDL level. And one significant part of the test that we are performing is the food intolerance, and that is something that in different way is significant to a huge group of people. And several months now we are making some experience and trying to involve the histamine intolerance as a part of routine testing within the nutrition test. And today I would like to share a couple of words about DAO deficiency. Let me just switch on this screen. So, as you all already know, the human genetic is a subdiscipline within the genetic and biology, and it deals with studies of the gene variation and heritability and inheritance in humans. Additionally, there is a subdiscipline within the human genetics that deals with genetic variation with medical significance. The clinical outcome for certain condition is influenced from two main factors, as Boryana already said before. It's not just the genes, it's a lot of the environmental impact in the severity or the visibility of specific condition. So there are some medical conditions that solely rely only on the environmental factors that are more right on our graph, like let's say a traffic incident. And there are conditions that are more influenced by the genes, and those are positioned more left on our graph here. And those are what we say monogenic diseases. Of course, the vast majority of the medical conditions are those that are influenced by both factors, and somewhere in the middle of the graph here. For instance, we have breast cancer, which is associated with BRCA mutation gene, and it would go a little bit on the left side. We have lung cancer, which is associated with tobacco consumption, and it will go a little bit on the right side as within the environmental factors. And of course, there is a huge field with complex or so-called multifactorial diseases that are somewhere in the middle. Also, the food ingredients are equally important as our genes, and that's why the food intolerances are displayed in this vast majority of the graph, influenced by both environmental and genetic factors. We all know that we need some of the key components for the enzymatic process within our body, while other components from the food are toxic and that they need to be removed from our body. Inability to process those components is what we call food intolerance. Here on this slide you can see a lot of known huge list of possible food intolerances that we usually test within different nutrigenetic tests. We all know about gluten sensitivity and inability to process the gliadin proteins within the wall of the guts that might lead to gut inflammation, which will end eventually might end with celiac disease. Intolerances to some sugar like sucrose, maltose, lactose, fructose intolerance may lead to diarrhea, abdominal pain, bloating. We also know about sulfate intolerance and monosodium glutamate intolerance, which is connected to a consumption of Chinese food, as they have more of these ingredients within this kind of cuisine. It's known that they can lead to dizziness, sweating, flushing, and of course thiramine intolerance, and very similar to our topic today, which is histamine intolerance, that might lead to migraine, hives, skin rash, and joint pain. So what is histamine? Histamine is a organic nitrogenous compound involved in local immune responses, as well as regulating physiological function in the gut and acting as a neurotransmitter for the brain, for the spinal cord, and for the uterus. Once it is formed inside our body, the histamine is either stored or it will be rapidly inactivated by two degradative enzymes. One is histamine N-methyltransferase, and the second one is deaminoxidase, which is our topic for today. In the central nervous system, the histamine is released into the synapses, and it's primarily broken down by histamine and methyltransferase, while in the other tissues, both enzymes may play a role. It's also interesting to share that some bacteria are capable of producing histamine. They are using histidine decarboxylase enzymes, which is unrelated to those that we found in the animals. So because of that, some fermented food and beverages naturally contain some quantities of histamine. And for instance, sake, your Japanese drink, it contains histamine in 20 to 40 milligrams per liter, and wine can contain from 2 to 10 milligrams per liter, which is a significant range. So different SNPs in the AOC1 gene that codes the deaminoxidase, and different SNPs within the HNMT gene that code the histamine and methyltransferase are associated with a wide variety of disorders causing overactive immune response or overactive immune system that may lead and may range, may lead to different kind of other condition. from ulcerative colitis to even to autism spectrum disorders. So histamine degradation is very crucial to prevent this overactive allergic reaction to sometimes otherwise very harmless substances. So DAO is typically expressed in epithelial cells at the tip of the villus of the small intestine mucosa. So if we have reduced DAO activity, it is associated with gastrointestinal disorders and widespread food intolerances. So this is due to increase of the histamine absorption through the enterocytes, which will increase the histamine concentration in the bloodstream. You can see here the histamine metabolism and the structure of the protein, and here is the main effect of the enzyme. So approximately 10 to 12% of the population suffer from DAO deficiency, which is very big number. Especially it is considered problematic within the middle-aged woman. Deficiency of DAO activity is because of the genetic components, some polymorphic variants of the AOC1 gene, and it can be because of some environmental factors, using of some non-steroid anti-inflammatory drugs, which can cause a delay of the breakdown of the histamine or release histamine in the body. It can also be related to the alcohol consumption, because it is known that alcohol increases the permeability of the cell membrane and thus will lower the histamine tolerance limit. And it can be also connected with some inflammatory intestinal pathologies. So it's a wide variety of problems. From what I already told you, you can already conclude that DAO deficiency can cause multisystematic pathology covering wide range of systems, thus causing wide range of symptoms. So the symptoms appear when the histamine levels approach to 50, 60 milligram per liter. So the weak symptoms are observed in the respiratory system. That may lead to nasal congestion, to asthma. We can also observe some weak symptom in the skeletal system that may lead to osteopathic pain. Next, some of the symptoms are also observed in the cardiovascular system, which can lead to hyper or hypotension, arrhythmia, to the muscular system that may lead to fibromyalgia, to muscle ache. More frequent symptoms are observed in the epithelial system that may lead to urticaria, to atopic skin, to psoriasis, and also at the end of the digestive system, which can lead to IBS, to constipation, to stomach pain, to vomiting. However, the most frequent symptoms are observed to the central nervous system that lead to migraine, headache, hangover, and dizziness. For the diagnosis, the case history is, of course, essential. However, since many complaints, such as the headaches, the bronchial asthma, the hypertension, the arrhythmia, sometimes dysmenorrhea at the women may be caused by different things than the histamine intolerance. It is not surprising that half of the suspected diagnoses are not confirmed. So the diagnosis is usually made by intentionally provoking a reaction. And because, as I've said, that some of this histamine can potentially cause life-threatening conditions, the genetic typing of the allelic variants for the DAO gene is preferred. So the heterozygous or homozygous recessive genotypes of the SNPs that are shown here on the screen are associated with the increased risk or the reduced DAO activity. Here is the gene. So the gene is AOC1 gene, amine oxidase copper containing 1, which is the same, or the synonym is the ABP1, amyloid binding protein 1, copper containing. It is located on the 7th chromosome on the Q arm. It contains 85 SNPs, of which 17 are in the coding sequence. And at the end, here were our experiments that we've made, and here are some of the genotype and phenotype combination that are comparable with the tau activity, which eventually will lead to histamine intolerance and to the medical condition that we already spoke about. So people with the genotypes with reduced tau activity should avoid food with high histamine, such as beer and wine, fermented food, aged food, and they should avoid some drugs also that may also provoke. They do not contain histamine, but can release endogenous histamine in the body. We should also be careful about some probiotics, because some of the strains also produce histamine. And also some foods like citric fruits, they don't contain histamine, but they also stimulate the body to release more histamine into the bloodstream. And of course, in these conditions, special nutrition scheme should be made to avoid some certain type of foods, or if this is not avoidable, then it can be tried with intake of tau pills, which are now available together with the food, which will reduce significantly the symptoms of histamine intolerance. So the point of the talk was that this. By the way, I'm the last one. This with severe reduction of the activity is the mine own genotype at the bottom. So this is something that many of us are experiencing, and now we are looking to incorporate this in our nutrigenetic panel. As Boryana said before, it's always a way how to incorporate more information and to produce more data for the patient at the end. Thank you very much.
Thank you, Robert. Thank you very much.
Let me just...
We will discuss at the end of the panel. Petri, please go ahead. It's your turn.
Yes, hello everybody, and good afternoon from Helsinki, Finland. Though this picture is not yet from Helsinki, so we don't have any snow here. So lucky us, but it's not so far away anymore. Okay, I'll share my screen. Let's see. It's a little bit slow motion. Let's open here. Let's see. Doesn't it show it to me? Let's see all the other applications.
Do you want us to present your slides?
Yeah, sure. I will take it because I don't know why it's not showing in that PDF. I will open up the PPTX, so it won't be a problem. So let's do it like this. Okay. Somehow it didn't show the PDF at all. But okay. Okay, I'm sure you can see it now.
Is this Helsinki or not?
Oh, this is unfortunately, it's from not Helsinki, it's from Oslo, also Norway. So where our company Sinsino founders are from. So not so far away, 1 hour flight from here. But of course, it looks fantastic, and yeah, you know, they're shore of the Norway, so it looks like this. It's fantastic views, so you should visit there. But yes, I thank you first of all, Dr. Georgiev, for this opportunity to come over here and talk about a little bit about Sinsino and what Sinsino is doing, and because we are playing on the world of fat acids, which are actually the oil of our engines. So first of all, a couple of words from Sinsino and from myself also. So I've been working with Sinsino for 6 years. So I'm working with it. I'm not working in Sinsino, so I'm working with Sinsino. I have my own company. I'm working through that. And yeah, I've been studying and having a lot of sessions with professors and all fat acids researchers, and really going deep on the fat acids, which is I just love it, because as I said, fat acids are running our engines. But let's a couple of words from Sinsino. We are a global company at the moment, working in more than 107 countries, and officially we have opened up something like 37 markets, as you can see from the map. Companies Nasdaq listed in the first North Premium growth market in Stockholm Exchange, so anybody can buy the shares. I don't give any tips for that, but it could be quite a nice purchase at the moment. So the growth has been double digit already from the beginning of 2005 when the company was established. We have also a charity in India, so we have a school. There are more than 1,000 students in the school, which I just love. Actually, my question is, everybody wants to feel good, stay fit and be healthy, naturally. But at the same time, why health-related problems are increasing, and they are increasing fast? So it's really a time to ask why. Why is it like this? And yeah, one of the reasons is here. Still some while ago, food was very good, what we were eating. We were really getting the food from Mother Nature. So we get all the necessary nutrition, good fat acids, vitamins, everything from there. And what has happened then? We really start to produce the food. Processed food, ultra-processed food, low nutrition density, low vitamins, a lot of fat acids which we don't need in such a big scale, especially vegetable-based fat acids, omega-6 fat acids. And what has happened because of that, the overconsumption of omega-6 based fat acids has caused this problem. For our DNA, the omega-6 omega-3 balance was really, it was stable, it was 1-to-1. Already before 60s, it started to go up, but it was still acceptable 3-to-1, which actually science says that it should be at least 3-to-1 or under it. On 60s, there's a turning point. It's 4-to-1. So omega-6 against omega-3, 4-to-1. And this is the cold fact today. In Europe, it's 15-to-1. And rest of the world, it's 25-to-1. We are quite a lot measuring and testing people now in Asia, and I must say that I almost had a heart attack when I saw the numbers from there. It's getting totally crazy. It's close to 35-to-1. So what can we do for this? It's a huge problem, and of course it's causing problems to the cell level. And this is one of the biggest problems what it's causing if you don't have the fat acid balance in your body. It's causing a problem of absorbing. And when your cells are reduced in function and you have a hard cell membrane, the problem really occurs that whatever you eat, even though if you eat well, you eat good, it doesn't absorb to the cell level. But it's two-way problem. Vitamins, minerals, and etc. don't go to the cell level, but the waste is not going out. So it's a two-way problem. It's causing big problems on your metabolism. Of course, it's causing problems with your brain, with your heart, with your blood vessels, with your gut, joints, almost everything in your body. So to fix the problem, to get the balance on fat acids, then nutrition starts going to the cell level, and also the waste starts going out. So the metabolism of your cells starts working normal. So we are not searching for something abnormal, but no, we are searching for normal cell function and normal metabolism. We have a test, so we can test it. We are actually globally the biggest fat acid tester. Yesterday I checked it, we have made more than 716,000 tests globally. So we have a huge data bank from the fat acids. It's extremely simple test, which you can do at home. Small box, everything is in there. You just stick your finger, a couple of drops of blood, you try it, put it in the envelope, and you send it to the laboratory. And the laboratory is analyzing the sample. It's anonymous, so there's no name on it. It's just a code. And with a code, you can pick up your test. Very simple, very accurate. Actually, with this kind of test, you can measure more than 1,000 different factors, though we are taking only 11 different fat acids from it. So this is the laboratory analyzing it. It's in Oslo Science Park, Vitas AS laboratory. It's widely used with the universities and hospitals all around the globe. And this is how the test looks like. It's quite visual. So you send it over, and then you go with your own barcode, and you can pick up your test result. It's very simple. You will get it on a PDF form. It's visual, but there's a lot of information on the test also. Every single fat acid it's online, so you can see what's your result, what's the result we are searching for, and what's the deviation of it. And then it's also visual, as you can see. Naturally, if it's in red, it doesn't promise something good. And the most important things what we are measuring there is actually omega-6, omega-3 balance. We see that, but then we also calculate omega-3 index, which most of the people, they know that the omega-3 index should be in a level 8 till 12%. And it means that how many percentage of your blood fatty acids are omega-3. If it goes under 4%, then there might be some high risk of cardiovascular problems. Also some other problems like cancer, and the risk goes much higher. But then we also see how your cell membrane is. So we can see how is you absorbing. And that's quite interesting, because many people, they have had years and years some big absorbing problems, and they've been running in the doctors, and doctors don't have any tools to find it out what is the problem. Then we make this kind of simple blood test, and we can see the problem there. Nice thing is that we don't do only one test. We do the first test, then we start fixing the problem, and after 4 months we make another test. Because in average, the renewing time of the cells, it's 3 months. So that's why we have 4 months between the tests. So this is the cold fact of the numbers from the tests. So globally, 95% of the people are out of balance. They don't pass through the test. And in some countries, of course, it's even worse, like in US. Oh, we know the diet of people in US and actually also in UK. it's a little bit same problem. So 99% of the people are not passing the test, which is it's even critical for the if you are thinking about nations and the health of the nations. These guys has been thinking about it. What could be the solution? What can be done to fix this problem? Dr. Paul Clayton, actually, I think he's been visiting quite many times in Sofia, also giving lectures at the university there. Of course, now last 2 years, I believe it's been online, so traveling has been a little bit restricted. I heard there's some kind of virus going around or something like that, so I have to be careful with it. There's Ulla Ede, who's actually the big master of our leading product. And Dr. Angela Rizzo from the University of Milan, she's actually mother of this tri-blood test method. So she's been studying it quite a lot, and already somewhere right 94, 95, they made the first blood tests. On that time, I heard you could measure from the drops of blood 3 different ingredients, and nowadays more than 1,000. So yeah, that's the science, how fast it goes. And then Dr. Abraham, he's the latest come on board, and also long history, or more than 40 years experience on nutrition and health work. So our promise is 130 days will bring you back into the balance. So how can we do it? How can we fix your brain? We can fix your heart. We can fix your heart blood vessels. We can fix your gut, your joints, your skin, your vision. So how can we do it? A simple solution. Very strong olive oil combined with very strong EPA and DHA omega-3. So we know how it's working because we do the test. We do the test before, we do the test after 4 months. There's also vitamin D3 added. As we know, vitamin D is extremely valuable, especially now. Everybody needs it to keep away all kind of viruses. Also vitamin E added. It's all natural product, and it's unique also because it's by weight. So you take it by a weight. That's why, of course, it's from babies till grandfathers. So reaching the balance between omega-6 and omega-3, that's the first step, feeling good. Staying fit and, of course, being healthy. That was my message. Change your oils. Thank you.
Thank you very much. Really very interesting message. And also extreme balanced presentation. Thank you very much. So now I will use the opportunity to moderate this session to put 2 questions, and I will give to every one of you 1 minute to answer. The first question is, where do you think the lifestyle testing will be in 2030? Boryana?
Oh, I think it's really hard to imagine from this moment, because in the last few years we have seen extremely fast advance of the science behind the lifestyle testing, and we have reached, for example, heights that when starting 7 years ago, we didn't believe are possible for such a short period. For example, currently we have reached, for example, evaluating personality predisposition and mental health traits. So I think in the next few years, we can have really complete programs from physical traits, for aging traits, for mental health traits, that we can actually help the clients in extreme detail to tailor their lifestyle according to their genome.
Robert?
Yes, I agree. I think that the lifestyle testing will become routine predictive genetic testing. It will become something that is, I would say, a field that at this point is just a price. It's a cost of the test. It is still high, the cost of sequencing. Of course, many of the lifestyle testing are directly connected with the clinical genes, with the health of the patient, and in, I say, maybe less than 10 years, I expect that we will deliver bigger panels which will be more informative, which will lead to maybe we already have some of those personal pills with all the ingredients inside, specifically designed for that person. You'll have a mobile application with all of the data that you need for today, designing your daily meal plans and your supplementation. So it will certainly go far further than what is today.
Petri?
Yeah, I'm absolutely agree with Robert. So it's definitely measuring everything from your body. It's already quite normal. So the gadgets are getting smaller. For example, I'm wearing the Oura Ring, which is collecting. Yeah, good choice. Actually, it's made in Finland, so it's a Finnish company.
Yes, exactly.
But it's very interesting how even this ring has been, what has happened with it the last couple of years. So the data, what it can collect and provide for people. But I believe there will be applications and which will collect more data from different sources. So, for example, you do the fat acid test, you go to do the test with Boryana, and it will collect all this data in one place, and then it really starts kind of following you and giving you instructions that, hey, Robert, hey, go to gym today. So and don't eat so much that. Okay, of course, in some sense, people maybe don't like it if it's controlling too much, but I think it will be also in a large scale. We can collect data which will, for example, prolong your living age. So, and of course, it's not how long you live, but how healthy you are when you are living that life. So that's the thing. So.
Thank you very much. We have one question from the audience, I think is for Petri, but this will be the last question. The second question is also from my end. When we had the session on genetic testing in pregnancy and after delivery, there were a lot of concerns about ethical issues. Are there any ethical limitations in the lifestyle testing, Petri?
I'm sure there are. And okay, what I actually like, I had just had a discussion about it with the professors of our company that because we have this first and second test, and there's no name on it. There's just a barcode. I was asking that why don't we collect this data so that we can identify who made the first test and who made the second test and what happened between it. And they said that we don't want to do it in Zinzino because we want to keep the privacy of the people. And I just love that answer because it is like that. So
Robert?
Yes, the simple answer, yes, there are ethical issues. The genetic is very complex. We usually get some data that were not asked within the test sometimes. So at this point, we are trying to structure the way of genetic testing anonymously with codes and in a way to deliver only the results that are willing, that are agreed in front with the patient. At the end, it was a huge scandal in some of the countries that some of the genetic testing companies are selling the genetic results. So it will be an issue, and it is up to us to try to prevent our patients from disturbance and further ethical implication of these data. It will be a problem but IT technology is also progressing in both fields. For those that would like to steal some of the data, and the other side of those that are preventing our data. So I believe that there is a solution for this, but yes, I agree that it is a huge ethical issue at the moment.
Boryana, you touched this topic partially in your presentation, but still just few words. Do you think that ethical issues are a big limitation for lifestyle testing?
It depends, doctor. I think one of the huge ethical discussions that we should have in the field is about this segment of the clients that have already chronic serious diseases that want to undergo genetic lifestyle testing, because I'm sure you're all well aware that it is widely accepted belief that with change in your lifestyle, specifically nutrition and supplementation, you can revert serious diseases or heal them, which is actually not always true at all. And a lot of patients are actually misled that if they continue with their lifestyle efforts, they can avoid medication, that they can avoid the classic medical support that they need actually in order to survive. And we're having this issue with cancer patients quite often because of my personal story, of course, because I'm 10 years in complete remission, but I'm mostly lucky, to be honest about it. Yes, I have made extreme changes in my lifestyle, but I have by no means cured myself with lifestyle changes. And I think these topics should be really carefully communicated to these patients that lifestyle changes can have limits. And I think the industry was extremely unhealthy patients in order to help them continue to be healthy.
Excellent answer. Petri, there is a question for you from the audience. Thank you for your insightful talk, sir. How do you achieve to stabilize the components of supplement, such as vitamin C? Please, a very short answer.
No, it's absolutely no problem. So because the supplements are taken by a weight, so you never can exceed the quantity. So it's absolutely no problem.
Thank you very much. Thank you for your excellent inputs, Boryana, Petri, and Robert. I'm really indebted for your participation and hope to see you next year again on our Biotech Atelier. Bye-bye now.
Thank you, doctor.
Thank you, sir.
Bye-bye.